We are looking at today's health headlines, including a look at COVID and hair loss. Good morning.
Good morning.
Dr. Stryker.
Back with us. Great to be back, I bet, huh?
Yeah, oh, yeah.
Well, let's get right to it. People always have tons of questions for you. We teased it a little bit there, COVID and hair loss. Connection?
There is absolutely a connection. You know, a couple of years ago, early on in the pandemic, there's reports of people losing hair with COVID. No surprise, people that get serious illnesses lose hair. But the question was do you lose more hair if you get COVID than you do with just other viral illnesses? Well, this data has just come out. There have been a couple of studies specifically looking at this. And yes, the answer is that you do have an increased risk of losing hair with COVID compared to other viral illnesses. It also depends on how severely sick you are. So in this particular study, people that had mild cases of COVID, there's maybe a 1 out of 4 chance that you were going to lose your hair. But if you were moderately, severely sick, it was almost 100%. And we're talking about generalized thinning, not big patches of hair. So if you get COVID and if you're going to lose hair, what can you expect? Well, first of all, it's not going to hit right away. It's going to hit at least 3 or 4 months after, sometimes longer. Here's the good news. It's not going to be all of it. It's less than 50% at its extreme. And then the really good news is that in most cases, it does come back. But the real question is why? Is it COVID itself is doing something to the hair follicles, or maybe it's the drugs that are being used? And that's what we don't know yet.
All right. STI, a way to reduce getting an STI. That's the same as an STD?
Well, yes. Sexually transmitted infection is the newer terminology because they're really not diseases and nobody wants an STD, but an STI isn't so bad, right? But this is the thing. There, for 6 years in a row, there has been an increase in STIs in this country. So we're thinking there's got to be new strategies. Now, a few years ago, I had a doctor friend who was newly single, and every time she was with someone new, she just took an antibiotic after she had sex just to prevent getting an infection. And I thought, okay, well, that's crazy. But now maybe she was onto something because there have been a couple of studies that have come out saying, okay, instead of doing what we've always done and wait and go and get a test, and then if you have gonorrhea or syphilis or chlamydia getting treated, now some experts are saying maybe you should just take the antibiotic right away. So in this study, they gave doxycycline, 1 pill of doxycycline, to people who were at high risk of getting sexually transmitted infections, and they found that there was more than a 50% decrease of them getting gonorrhea, syphilis, or chlamydia. So on one hand, this seems like it's a good idea, but this is not necessarily the way to go because first of all, you know, we are worried about resistance, about side effects from the antibiotic, but even more important, if people say, well, I'm not going to bother to use protection because I'm just going to pop a pill, well, it's going to protect against those particular conditions. It's not going to protect against lots of other STIs. So in a pinch, yeah. But it's not something that necessarily should be done routinely yet. Stay tuned on this one.
All right. People may have thought they have COVID this summer, but it could have been something else.
That's right. So viruses are not sticking to their seasons. It was always predictable that there's flu season, there's cold season, and now we're seeing viruses pop up when you don't expect them. 3 viruses particularly that are emerging this summer. The first one is RSV, respiratory syncytial virus. This is a virus that's pretty common in both adults and kids with a cough and just kind of general bronchial symptoms. But usually we only see it in the winter. It's almost never in the summer, and doctors are reporting that we're seeing a lot of RSV in the summer. Colds, the kind of colds that usually hit in the summer are not, in the winter, are now showing up in the summer, and they seem to be more severe. They're even calling them super colds because people are getting sicker longer with the common cold. And then the third is the flu. The flu is also not sticking to its season, and we are seeing more flu. The question is why? Well, nobody knows. There's theories, you know, maybe with all this hand washing and masking and isolating, those infections were hanging out, and now that people aren't being as careful, they're emerging. Immune systems may have changed. But the big concern, again, not proven, is COVID somehow changing these viruses so that they are now coming out at different times of the year. So bottom line is if you have these symptoms, yes, do your COVID test. See if you have COVID, but it might be something else. And don't stop washing your hands. We're seeing lots of other viruses.
All right, Dr. Stryker, thanks so much. You can check out our podcast, the Menopause Podcast. Thanks for being with us.
Thank you, doctor.
Thank you.
Hey, send a message to Pat and Paul. They'd love to hear from you. Today, the number is 773